Hey guys, welcome back to my YouTube channel. Today we're going to be talking about thermoregulation. Who is excited? He's excited. I'm going to go over a review. I am T-minus 1 week away from my test, so hopefully I do good. This is my studying. Anyways, let us start. Okay, we're just going to be doing the exemplars today. So we're going to be doing glaucoma, cataract, macular degeneration. Okay, starting with glaucoma. So what's a risk factor of glaucoma, you might ask? Well, being African American is a risk factor, apparently. Hypertension, diabetes, old age. It is manifested by tunnel vision, and it's gradual over time, but there is two different types of glaucoma. There's open angle glaucoma and closed angle glaucoma. So for open angle, think open over time, that it happens over time. So this is very painless. Versus closed angle glaucoma is, think about your hand getting like smashed in the door. It's getting closed, your fingers getting closed on, and it hurts really, really bad, and this is an emergency. So closed glaucoma is painful and it is an emergency. Now, why does this happen, you might ask? Well, you have aqueous humor in your eyes, and do I know what that is specifically? No, but I do know that for glaucoma, so when aqueous humor goes up, the intracranial pressure also goes up. And so if you have a closed angle glaucoma, it's trapping that aqueous humor so it can't get out. So that's why it's a more acute, painful issue. You have 12 cranial nerves, and the second one is your optic. Think you have two eyes, it's your optic nerve. And this is what can we do, and what are some ways we can diagnose it. Closed angle, so the acute emergency, you're going to see words like severe pain in the question or sudden severe eye pain in the question. And the first thing you're going to do is you're going to administer mannitol. So we just talked about mannitol in my last video over Reyes syndrome, because Reyes syndrome also does the ICP. It also increases the intracranial pressure, and it is an osmotic diuretic, so it is going to lower the pressure very fast. Another thing is too, it's emergency surgery. I have to look up the name, but it's some name I can't pronounce. Laser for peripheral iridotomy. Yeah, I can't pronounce that. But that's going to happen with closed angle glaucoma, and it's not the more common one. The more common is open over time. How they diagnose this is they do a tonometry test. I'm so bad at pronouncing everything. But basically a normal ICP is 10 to 21, 10 to 21, 10 to 21. So that's normal. Anything higher or lower is an issue. And so they'll measure this, and that's how they find out somebody has glaucoma, especially if it's open, it's over time. Okay, things to avoid when we're talking about glaucoma is bearing down the Valsalva maneuver when you're going pee and you gotta like add that extra pressure. Lifting weights, big no-no. Coughing, sneezing, bending at the waist, all no-nos, all not good. They all increase your eye pressure. And then also no Benadryl and no anticholinergics. So what do we know about anticholinergics? It's anti-secretion, so you can't dry mouth, dry whatever. And then what do we know about Benadryl? Causes retention. It holds things in. So these are things we do not want. We want to decrease the fluid in your intracranial pressure. So hopefully that makes sense. I kind of talked really fast. Okay, next one, macular degeneration, macular middle. So for the glaucoma, it's the peripheral. So macular is the middle. You can't see the middle. I'll show you a picture. Another thing to remember is this is not a common form of aging. If you see a question that's like, oh, this is part of the normal aging process, that is not correct. This is seen from a blurry spot in the middle. That's really all I'm going to talk about for this. Next one, we're going into cataract. So cataract, think cloudy, think blurry, and think thick. Think cataract, that shit thick, bro. That shit thick, because you thicken your lenses over time, and you'll actually see a lot of, like, if you're driving around, there's a lot of like cataract eye places, if that helps you remember. Excessive exposure to sunlight makes cataracts worse. So looking the UV light touching your eye, damaging it, that makes cataracts. Diabetes, alcohol use, And then prolonged steroid use could lead to cataracts over time. Often vision is getting worse at night. So for the solution, most people go through cataract surgery, which they're gonna remove that thick lens and they're gonna put a new lens in, and most of the time their vision ends up being normal. A lot of people get this. It's very, very common. I think it's actually one of the more common surgeries that happen. Okay, now let's talk about eye injury. So what do you do if somebody has something stuck in their eye? Do you take it out? Do you put water in it? Do you whatever? No, you actually want to stabilize whatever is in it. So if you have a piece of glass in it, you're going to want to cover it with a cup so that way your eyes don't move. It'll prevent both eyes. You don't want to just cover the one eye because this eye is going to move, and what do your eyes do? They move together. So you're going to cover both eyes with a cup or something to prevent further damage. Never take anything out. Think about if somebody was stabbed right now and they came up to you. Are you going to take out that knife? Well, you might not know not to, but yes, you're not going to take out the knife. The surgeon will take out the knife, and you could actually do more damage than good by taking out that knife. So keep that knife in you, girl. Keep that thing in you. But yeah, even if they have extreme pain, just do not put pressure on it. Like, it sucks. Do not put water on it. Do not do anything. Do not have them blow their nose. Do not bend down. Like, very much just keep as still as possible. Okay, one diagnostic tool that you can use to see eye injury or see if there's any abnormal things in the eye is called fluorescent. I'll insert a picture. Putting the fluorescent in the eye is going to stain it orange, and they're going to put a blue light on it, and it's going to show where the abnormals are with greater contrast, so that way they can see where to, take it out, do surgery. And then foreign bodies will glow green, so that would be a bad sign, and that's the purpose of it. Okay, other things to know: if you're giving eye drops, what you're going to want to do, I'll take mine off, but you're going to want to do it in the conjunctival sac, which is underneath, and you're going to want them to look up so that way they're not tempted to blink. So you might see questions on ATI that's like, have them look at the floor, put it in the corner of their eyes. No, you're going to put it in the middle to the bottom. Do not put it directly in the eye, and have them look up. Specific whether drops is going to obviously be from the medication. It's going to tell you how many drops to put in their eye. Okay, newborns get erythromycin eye ointment, and this is going to help reduce the risk of bacteria infections, which are very common in newborns. Well, not common anymore, we're preventing them, but they can get them, so that's why we put them in. You might be familiar with the Snellen and the Rosenbaum. I've never even said these words out loud, but basically the test where you stand 20 feet away, 20/20, obviously I don't have 20/20. Okay, that's basically a good summary. We're gonna go straight into practice questions now. A nurse is assessing a 65-year-old patient who reports blurred vision, difficulty seeing colors, and trouble seeing at night. He has a history of uncontrolled diabetes type 2 and hypertension. Based on the symptoms described in the patient history, which sensory perception issue does this patient most likely present with according to the provided sources? So A, glaucoma, B, macular degeneration, C, cataracts, and D, peripheral neuropathy. Give you some time to answer. Okay, so this one's an easy one. So keywords, blurred vision. Keywords, difficulty seeing colors, and then ding, 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 trouble seeing at night. So what do we know? We know cataracts. You have trouble seeing at night. We know C equals cloudy, cataracts, cloudy, and blurred vision. So if it was glaucoma, you would have seen tunnel vision. Macular degeneration, you would have seen a middle. So cataracts is the correct answer. According to the sources, which of the following is identified as a primary prevention strategy for maintaining vision health? A, screening newborns with erythromycin eye ointment at birth. B, having a yearly eye exam after the age of 60. C, using protective devices like safety goggles while working. D, undergoing LASIK surgery. Okay, so this is asking for primary prevention strategy. So what is the first thing somebody could do, being by themselves, not going to the doctor, that's going to help their eyesight? C, using protective devices like safety goggles while working. So yes, that's the primary thing. That's the first thing you can do. D, undergoing LASIK surgery. Let's be honest, like who's oh, I'm having difficulty vision, let me go to surgery. Like, no, it's definitely not the right answer. B, having yearly eye exams after the age of 60. Now, this is a good idea. However, this is the secondary prevention strategy that they can do to prevent eyes. And then A, screening newborns. See, that's a very much just for the newborn answer. We're talking about the general population. We're talking about everyone.